Hi everybody, Joel Palmer here at Vintage Fitness Studio, Vermont. One thing I get asked a lot about here in the studio and also in my chiropractic office, I get asked a lot of questions obviously about lower back pain. And I always get that question about what exercises can somebody do for their lower back. Sometimes people want to do some other things on their own at home. And so I'm going to go over a couple of things, a simple routine that I have patients do both when they're acute and when they're just trying to do some good maintenance work to keep things flexible, pliable, and strong. The exercise we're going to focus on a couple of main principles: mobility, range of motion, and then some strengthening. I'm going to go over a few of the exercises and then I'll just show you how I put it together for a workout. It's quick and easy, something you can do right at home. So first things first, we're going to start with something called a knee rock. A knee rock. You're going to lay flat on your back, knees bent, almost like you're going to do a crunch. And all you're going to do is rock your knees in a pendular fashion side to side. Knee rocks. Simple mobility exercise. Should be slow and controlled, sort of rhythmical. How far you go to the side is totally up to you. If you want to let your knees roll all the way to the side, all the way to the floor, and you have that range of motion, fine. Keep in mind when your back is more acute, if you're having pain, you may not go as far. Sometimes when you're acute, all you got is a couple of inches either direction, but that's okay. This will help to mobilize the lower spine, help to break up some spasm, and get a little bit of blood flow through there so that the tissue can start to repair itself. From there, we like to do something called a pelvic rock. I'm going to go sideways so you can see that a little better. Pelvic rock is just pressing the lower back down into the floor. If you're laying on your back, you can feel there's a little hollow here. Most of us will have that. And all you're trying to do there is just rock the pelvis and press the lower back down to the floor and relax. Press and relax. If your hand's not in there, you're going to press it and feel it press down to the floor and relax. Nothing rises up off the floor. Again, just a mobility exercise, and we're looking to hit a nice rhythmical movement pattern. Okay? From there, we like to go to toe in and toe out. Legs out straight. Great mobility exercise for hips and sacroiliac joints. You're just going to start with your toes out, and you're going to toe in and toe out. Toe in, toe out. Lay flat. Toe in, toe out. Okay? From there, we like to go to something called a curl up. A curl up. It's a little different than a typical crunch. In most cases, if you have acute back pain, if you're having any kind of disc issues, sciatica, compressive issues, lumbar disc degeneration, a typical crunch will compress down on those bottom discs and can actually oftentimes irritate the situation. So a lot of times when people are acute, I don't have them do a typical crunch. What I'll have them do is something called a curl up. Keep your right knee bent, your left leg out straight, lay flat, and much like the pelvic rock, we're just going to curl slightly here. We're going to lift up a little bit, which is a little different from the pelvic rock, but you're just going to sort of press with the abs, pressing down with the pelvis, and raising up slightly. By keeping the legs in the alternate pattern here, it helps reduce a lot of that compression on the disc and compression on potentially the sciatic nerve. Okay, so you'll do some that way, and then of course we'll switch and we'll do some the opposite way. Okay. From there, we like to go back to the knees bent and do some bridging. Now we're working a little more on some strengthening exercises. Going to raise the hips up. The idea is to not go into a full back bend. You don't want to arch your back too much. All you want to do is raise up at the top, sort of squeeze your butt tight at the top, pause for a second or two, and lower down. Raise up. Lower down. Again, if your back is more acute, you may not raise up quite as high. That's okay. You can keep it low in the beginning if you have to. again, we're starting to work on some strengthening here. Going to start engaging the posterior chain, hamstrings, glutes, lower back, obliques. Okay? So that's where we go next. After that, we're going to turn over and go into the all fours position. So we're just going to roll, press up into the all fours. And from here, we're going to do cat camel. Cat camel is a great range of motion exercise. It's also very good for hydrating the discs. It creates almost sort of a pumping mechanism that allows for a little fluid flow in and out of the disc to help pump up the disc a little bit. So we're going to start with a rounded back and press down. Rounded back, press down. Back and forth we go. How far you press down and round up, again, depends on your level of fitness and how acute your back might be. So, if you're having more acute pain, you may have to keep that range of motion relatively short. As you start feeling better, or if you're doing more of a maintenance program, then you want to take it through a more full range of motion. Okay? From there, we're going to go right into alternating bird dogs. Alternating bird dogs. So, left arm, right leg, they extend. Get them to so they're about parallel to the floor. Parallel to the floor. Again, you don't want to overextend. Just a parallel is good. Pause a second. Sit down. Go the opposite way. Sit down. Opposite pair. We're alternating the pairs. Back and forth. Again, when things are more acute, this might be a little more difficult. You may even have to pass on it. You have to see how you feel. But if you can, even if you can just get a little bit of movement, a little bit will start the recovery process and help you through that acuteness that you're dealing with. Okay? So those are the basic exercises. What I'll do is I'll go through next and just kind of show you how that all fits together. We'll just go from one exercise to the next, and I'll show you how it flows. And basically what we do is we do, for the most part, we do sets of 12 reps, and you'll see how that works. So let's try it out. We're going to try with the knee rock first. And so we're going to start with 12 reps. We go from one side to the other. So this would count as 1, 2, 3, 4, 5. You see how that counts out. Have to rush it. It's a mobility exercise. Take your time. It's not supposed to be real ballistic. There you go. 12 reps. Then we'll go right to the pelvic rock. Same thing, 12. Turn sideways. You can see this one a little better this way, I think. So 12 here. So we're just going to rock. That's 1. 2, 3, 4, to, let's go to our bridge. Here we go. 12 of those. So we're going to raise up, squeeze, and down. That's one. Raise up, squeeze, down is two. Pause at the top a second. Just go sort of squeezing with my butt, just kind of squeezing and pulling a little bit with the hamstrings as well, just to emphasize the strengthening aspect. I can already tell you I've lost count, so can't talk and count at the same time. Have to work on that, I guess. Alright, let's go to the curl up. We will do 6 on each side for a total of 12. So the curl up, again, we're just curling here. Again, in the beginning, if you're very acute, you might not raise up as much off the floor. You might just focus more on, again, that pelvic rocking motion. Six, and we'll switch. Again, I like to pause at the top. I like to engage the abs, feel them work, and then relax. It just intensifies that action a little more. The last thing you really want to do is rifle through it, whip through it, bounce through it. It doesn't do your abs any good. If it's all momentum, then it's just not the same exercise. To the all fours position, so we'll roll here, up to our all fours position, and go to cat camel. So from the rounded position to the press position, that's 1, round, press it down, 2, more, then go, from there we go to the alternating bird dogs, left arm, right leg. I like to pick the head up a little bit as well. Try not to do it looking straight down at the floor. Engage all of the spinal extensors. You want that strength through the entire spine, and part of that is strengthening the muscles that hold your head up all day as well. So you can get a little extra work in by holding your head up and looking ahead a little bit. So we'll do 12 total of these. So in effect, you're doing 6 on each side. All right. Again, just pause at the top. Beautiful. And those are sort of the basics right there. If you're looking to do a little more maintenance work and get a little more strength in there, then I add 2 more exercises, which are the side planks
and just a regular plank. They can be tough for people when they're having acute low back pain, so keep that in mind. Most of these are doable even when you're feeling acute. Your level might have to change a little bit. The side planks and the planks can be a little tough when your back is acute, but once you're out of the acute phase and you're into your maintenance phase, you're trying to keep your back strong, these are great exercises. I'll show them to you. The side plank, again, I do 12 reps total, so we just do 6 each side. I do them as pulsed side planks. A pulsed one, we're here on our side, and we're just gonna pop up, hold it, a second or two, drop down. Pulse up, hold it a second or two, drop down, and that's a side plank. I would do 6 on that side, we'll switch it around, bang, we do 6 on this side as well. And then finally, I like to just finish out a maintenance program with just a regular low plank. That one, I typically will just hold that one for 30 seconds. You know, if you're in better shape and you want to go 45, 60 seconds, 2, 3 minutes, whatever works for you. But for basic, just maintenance kind of stuff, I like to just hold it for 30. We'll hold it for 30, and then that will be the whole routine. And as you can see, it doesn't take a lot of time. If you whip right through it and you're doing a maintenance thing and you're not acute, then you can flow from one exercise to the other. And it's a great home maintenance program. It's also a great program for when you're acute. Just remember, you got to work within the ranges of motion you can focus on and tolerate. So try this out at home. Simple program. Put it to work. Let us know what you think. Check back in the future for some more videos and instructional stuff. And remember, life is heavy. Train for life. We'll see you here back at Vintage Fitness sometime in the near future. Thank you.